You think we should get started?
Absolutely. My name is Sue. I'm the marketing and event coordinator with Kendal at Home, and I'd like to welcome you to Care Coordination Corner today with Larissa Lynds, who is one of our care coordinators out of the Massachusetts area. She is going to talk about heart health with us today. February is Heart Health Month. She's going to give us an overview of what is heart disease and ways you can prevent it as you age. Thank you, Larissa, and we look forward to hearing what you have to share.
Thanks, Sue. So February is Heart Health Awareness Month, and I have to be honest, one of our care coordinators is a nurse, and she planned to do this topic, but I pilfered it from her so that we could get out some good preventative tips and information before Heart Health Awareness Month actually began. So all due credit to Terry Lanham for her idea. Heart health is a really important topic. It affects more Americans than any other illness, but I hope to just bring a little lighthearted humor to the topic. It turns out that in the area where I worked right before I joined Kendal, the cardiac team at St. Luke's thought the same thing. They felt like there needed to be a little levity to the topic of heart health. So take a page from their book. So I said a little bit that heart health does affect more people than any other illness in the United States. It is the leading killer of both men and women in the US. Unfortunately, more people die of heart disease than all types of cancer combined, which seems like a very overwhelming figure and statistic. But what's really important to know is that 80% of heart disease is preventable. There are so many things we can do in terms of our lifestyle that can impact our health. And that is to say, everyone at every age can do these things to try and improve their heart health or prevent heart disease. Unfortunately, 80% of adults over 65 live with at least one chronic health condition. 58% of people over 65 have high blood pressure. 40% have high cholesterol. 29% of older adults have coronary artery disease, and about 14% of Americans over 65 have heart failure. So it is a significant issue that we're facing. Now, when somebody says heart disease, what exactly are they talking about? There are so many different diagnoses. Heart disease really is an umbrella term that incorporates all different medical diagnoses that affect your heart. This includes congestive heart failure, coronary artery disease, hypertension or high blood pressure, high cholesterol, angina, irregular heartbeat is also known as arrhythmias, and of course, heart attacks. So there are things in our lives that increase our risk for heart disease. So some of these are high blood pressure, cholesterol, our weight, smoking. People with high levels of stress in their daily lives are more likely to have heart disease. Those with diabetes are 4 times more likely to have heart disease than those without diabetes. And then unfortunately, some of us, even if we live the healthiest of lifestyles, are more inclined to get heart disease as we age just because of genetics. Now, before I start talking about the signs and symptoms, I will say that it is important that even if you have not been diagnosed with heart disease, it is important to continue to talk to your physician because our hearts change as we age. even just in terms of the actual anatomy of our heart. As we get older, arteries of the walls harden, chambers of your heart increase in size, and heart rate naturally changes as we get older. Sometimes it speeds up, sometimes it slows down, and sometimes it becomes very irregular. So if you get to a point where you have a concern, don't question it, just talk to your physician, because even if 2 years ago you got a clean bill of health, it is important to pay attention to those signs. So some of the common symptoms of heart disease, things that we all associate and send up red flags, so to speak, are chest pain, shortness of breath, pain or numbness in your arms and legs, pain in your neck and jaw, and swelling or fluid retention, which is also known as edema. So these are things, again, that many people, when they get them, it triggers that thought in their mind that this sounds like a heart problem. But there are also some uncommon symptoms of heart disease that not everybody experiences, but that are also worth noting and worth talking to your doctor about, like fatigue, increased pulse, sometimes even just frequent indigestion or nausea can indicate some heart disease, and what the CDC calls flu-like symptoms. So just feeling run down, achy. Don't just write it off as something minor. It's good to talk about it. Another thing that I think is fascinating about heart disease, and something that deserves a lot more attention, is that different diagnoses present differently in men and women. So something that has become more publicized is that heart attacks look different in men than they look in women. I think when you think of movies and somebody has a heart attack, they clutch their chest and they say that their arm hurts and they become winded, or they lose consciousness. Or that's something that I think most people look for. However, in women, a heart attack looks more like that shortness of breath, jaw pain, nausea. And so many heart attacks in women go undiagnosed. 20% of heart attacks are actually they consider them silent, because we can experience them, not seek medical attention. It takes a toll on our bodies and we never know about it. Men tend to experience heart attacks at a younger age than women do. And they do tend to bounce back more quickly after an episode, whether it's a flare-up of a chronic condition or something like a heart attack. They are less likely to stay in the hospital long-term, and they're less likely to go to a skilled nursing facility and subsequently move to long-term care facilities. Women also have certain non-cardiac medical diagnoses that have been linked to heart failure or heart disease, like polycystic ovarian syndrome and endometriosis. Women who have either of those diagnoses are 400 times more likely to experience heart disease. Lastly, I will say that heart disease is harder to diagnose in women, which I did not expect to find in my research. But common testing methods, like an angiogram, which is also known as a cardiac catheterization, it only explores your larger arteries. And most women experience blockages in the smaller arteries. So you can have these cardiac tests, get a clean bill of health, but actually be experiencing some of these conditions. So I mentioned an angiogram, but there are many different ways that heart disease can be diagnosed. Sometimes it just comes down to monitoring your blood pressure. People who have chronic high or low blood pressure would fall into this category. A doctor may recommend a cardiac stress test. or an electrocardiogram or an echocardiogram. The good news is that even as more people in the United States have heart disease than any other illness, there are many treatment options. Some of these include just behavioral changes in our lives. The American Heart Association recommends 20 minutes a day of exercise, which reduces your risk for heart attack, stroke, and it helps keep your heart strong so your heart rate stays consistent. They recommend that you stop smoking or don't start at all. Decrease in alcohol consumption. After a night of drinking, which for women is 2 drinks and for men it's 3, the next day your heart rate will be increased. So the less you drink, the less likely your heart rate is affected. Change in diet, reducing your intake of trans fats, high sodium levels, and an increase in fruits, vegetables, healthy fats like nuts and olive oil, they recommend. I know that we will be talking a little bit more in our lecture series about the Mediterranean diet, which is said to increase your life expectancy and your cognition as you age, but it also improves your heart health. And then, of course, there are medications that many people are prescribed if they have these diagnoses. So there are blood thinners, ACE inhibitors, which decrease the resistance in your blood flow, which makes your heart work a little easier. Beta blockers, which decrease blood pressure, diuretics, they decrease your fluid retention, both in your extremities and around your heart and lungs. So those are very important. And of course, we want to reduce stress, and hopefully in the next year, we'll all have a reduction in our stress levels. Unfortunately, when you're diagnosed with one of these conditions, there are significant impacts on your day-to-day life. And it sets us apart from those who don't have heart conditions. So for example, the recommendation on how much fluid to drink in a day could be significantly decreased. Your dietary restrictions will be different than other adults in your age group. And you may be asked to monitor your weight every day because a jump of 3 pounds or more is considered significant alarm for those with heart disease. So what we see more than anything, I think in the older community, is that it's a really big adjustment in terms of your lifestyle, whether that's, increased medications that you never had to take, having to monitor your health more closely. It feels for many people like a lot of effort, but it is important to be consistent and to take your medication as recommended and follow those restrictions. But everything in moderation. So there are certain things that we consider indulgences that are actually very good for your heart, such as red wine and dark chocolate. So with Valentine's Day coming up, keep that in mind. Does anybody have any questions? Okay.
Don't know if you want to stop sharing your screen, and there we go.
Larissa,
Yes.
400 times more likely to have heart disease if you have polycystic ovarian syndrome or endometriosis. What's the link?
I didn't read the background on the science behind it, but it does seem that there is a correlation. I also read that there's a correlation in adults over 60. If you are unable to go from a sitting to a standing position from the floor without using your arms, that you are 20% more likely to die. Which, you know, these studies seem rather arbitrary, but I thought that was really interesting. I think it has to do with the stress that it puts on your body and the harder your heart has to work.
Oh. Every day you learn something you didn't know. Some things you wish you didn't know anyway, right?
But the good news is that red wine is still okay.
You could move white wine into that category.
Anything else interesting you found in your research?
You know, I did add most of that here, but I think the most interesting thing, the thing that I knew least about, was the fact that your heart changes so significantly as you age. And I think part of that I associated with lifestyle. So your arteries harden. I thought that had to do with your, you know, consumption, and really it doesn't. It just has to do with, as our bodies age, our physiology changes. So the fact that the chambers of your heart get larger as we get older causes your heart to work harder to fill those chambers. And so that could lead to heart disease.
You also gave us some really good tips of things that we can do to try and keep that heart healthier, with exercise, things to avoid.
You know, and I was on the Cleveland Clinic, I was with the Mayo Clinic and the CDC, and everyone recommends, everybody's biggest tip is that it doesn't matter what age you are, that it's never too late to start making those changes and affecting those positive changes in your lifestyle. Because some of these things, smoking, for example, your organs see an improvement, and they start to regenerate healthy tissue after just a month if you've quit smoking. So it is never too late.
That was a great tip. Anybody else have any questions?
This is Kim. I don't have any questions, but I thought I'd just share a little personal story that's a little funny, but just share it with you all. So, you know, I've always been pretty healthy, and several years ago, I started having my heart would just start racing. Like I'd be sitting at my desk and all of a sudden my heart would start racing. And I go, oh, you know, it's hormones. But there is heart disease in the family. So I went to the doctor and I said, oh, I think it's nothing. It's just hormones. But he said to me, could you let me diagnose you? Because I tend to go into my doctor already knowing what's wrong with me, right? So please, can I just run some tests and diagnose you? Okay, you can run some tests and diagnose you. So I went for a stress test, which, you know, was great. I had the stress test done. It showed nothing. He did diagnose it just as some, and I had to watch it. But that goes to show you that, you know, it does change with time, and it did resolve itself by itself. But that does kind of show you that your heart does change, your body changes over time. And really, I shouldn't have ignored the symptom for as long as I did and self-diagnosed. It could have been much worse, but it was really quite fine. So thanks for the reminder of that. That's my story.
Thanks, Kim. I'm glad that it turned out to be something minor and that you're doing okay.
I remember reading somewhere else, and I don't know if you came across it in your research, Larissa, that a lot of times women ignore the warning signs as indigestion.
Absolutely.
And they think, oh, it's not me. It's, you know.
There is a lower rate of diagnoses. Part of that has to do with the fact that some of the tests, like I said, don't pick up on the signs, but a lot of it has to do with the percentage of women compared to men who are caregivers, who tend to ignore some of their health conditions or some concerns that they have because their focus is on their loved one or on other aspects of their life. And so they do put that to the side, which is why I emphasized a little more about how there are significant changes, or differences rather, in men and women.
Any other questions from anyone today?
Thank you, Larissa. That was very informative.
Thank you. I thought I'd keep it short and sweet so we can all go watch history be made.
Right.
Thank
It's a
you all.
historic day. Thank you.
Good.